Hello. Good evening, fellow friends and loved ones. Yes, it's once again a great privilege and honor to come to your homes as we discuss a very important health condition. Yes, yesterday we were not able to have the discussion, and due to circumstances beyond our control. But this evening we come to your homes by God's grace and we discuss a very important health condition as we mentioned earlier on. Yes, last week we had a very interesting time as we talked about jaw pain and its associated problems. And this evening also is a very interesting condition. I'm sure you saw the flyers around, but if you by chance tune in to join us in our discussion this evening, we're talking about a condition that involves swelling in the hands, that is the hands, and then the feet, or either of them, and could affect other organs also. And so the condition is called lymphedema. Lymphedema. Yes, this presentation actually, before I begin the presentation, I acknowledge my senior colleagues who are championing this condition. Actually, it's an silent, but then there are quite a number of people who are affected by this condition, and so I acknowledge their maximum and their great input into managing this condition. Okay, thank you very much for your time. So without much ado, we zoom into our discussion. So the condition is lymphedema, or on a plain term, swelling in the hands and the legs, or either of them. Okay, so what is lymphedema? What is lymphedema? What are the risk factors? What is likely to occur when someone has swelling in your hand or your whole arm, or you have swelling in your feet? What does it mean? What are the treatments to that? How do you manage it? Is there a treatment to it? And then how do we reduce the risk of having this condition? And how do you manage this? By exercises, by therapy. And so we'll be zooming in to discuss more of this condition. Okay, so lymphedema, or we say swelling in the hands or the feet, actually it's accumulation of substances we call protein-rich fluid in our system. So lymphedema actually it involves two words. We have the lymph and we have edema. When we say with lymph, it's a particular structure in the body that helps to transfer fluid from one part of the body system into the other part of the body system, that is circulation. So this lymph is a very important component. So we have in anatomy, we have structures we call lymph, we have arteries, we have veins. I'm sure you've heard veins before because a lot of people have been talking about veins. But aside veins, we have arteries, we have lymphatic system, and then we have fluids in your system. We have something we call extracellular fluid, and we have intracellular fluid. These are all structures that communicate, that is, they transfer fluids from one part of the body to the other. So it's a system that we call an equilibrium. When we say equilibrium, that is a balance between two different states. So when there is balance between the intracellular component, that is inside the body system, and the extracellular component, that is within the vessels, if there's a balance between them, everything stays normal. But in the case where we have too much of structures, that is maybe, as we are talking about this evening, proteins in the intracellular component, that's the inner component, more than the one that we have in the extracellular component, there could be undue pressure to bring back that proteins back into the system, and this could cause a collapse in the system. So in the case of lymphedema, or the swelling in the legs or the hands, there is an undue pressure that is created in the system we call intracellular system. I'm sure I'll show you some pictures to buttress the statements I'm talking about, and so just stay tuned. And so there is improper balance between the intracellular system and the extracellular system, and this causes the upper limbs or the lower limbs to swell. So in this case, we have too much of protein-rich fluid in the tissues. That is, in your body, we have skin, we have muscles, we have tendons, we have blood vessels, we have ligaments, and then most importantly we are talking about today is tissues. These tissues are very important structures that helps to allow fluid in your body and also transport them into your blood vessels and carry them in circulation into your heart so that they can receive enough oxygen and blood back into the system again. So we're talking about lymphedema, swelling in the legs or the feet and then the hands. So the swelling can occur at different parts of the body, but what we mostly see in our clinical settings are the hands and then the feet or the legs. But in other ways, you can have swelling even in around the head region and also around the trunk region. But that is very, very scarce. Okay, so actually, when this condition happens, it affects the physical status of the person, that is where there is swelling, and also affects the mental status. So the person psychologically becomes down, that is, he doesn't have much confidence to come to the to the public because he sees that, oh, he looks different from other people. So he has swelling, his hands becoming big, and then walking about, people watching him, people even taking pictures of him. So he loses self-confidence. And so these are some of the things that, as my senior colleagues are also going through, they're championing for people to be aware of this condition so that they don't see them as outcasts and don't see them as spiritually inclined or spiritually accursed. But then it's a condition that could occur because of the disruption in the system, one of the systems they call the lymphatic system. So the system, you have the digestive system that takes the food into the body and then breaks it down and sends it into your muscles and your tendons to become strong. We have the sensory system, we have the nervous system, that's your brain and your spinal cord. We have the circulatory system where the blood vessels are, and also what we're talking about this evening, the lymphatic system. So the lymphatic system, that is where we have the lymph nodes becomes over pressured, and then it causes disruption or distraction of the system, causing lymphedema, where fluids are unable to return back in circulation again for recirculation. Okay, so mostly people who are affected by this condition called lymphedema are people who have had breast cancer, and so those who survived from breast cancer, and where after surgery there's likelihood of the lymph node, that is I'll show you the lymph node. I'm sure you are anxious to see the lymph node so you can appreciate it more. The lymph node is cut or affected, and also people who have endometrial cancer. So some of my friends also have started advocacy on endometrial conditions, and so if you have endometrial cancer and you have survived it, you are likely to be affected by your lymph node, causing lymphedema, where you have swelling in various parts of the body. And so let's take note of that. And so who are affected by this, who have the risk of being affected or having this condition? And those who have their lymph nodes removed. So when you have your lymph node removed, you could have swelling in this respective parts of the body, the hands and the legs mostly. And those who are also fat, that is those who are obese. Okay, sorry for the statement. You can be slim at the same time obese. Same way you can be fat at the same time obese. But obesity does not correlate with fatness, because there's a calculation that we have to go through. So first of all, you check your weight and then divide it by your height squared. So when you calculate that and has passed the 30 mark, that means that you are obese. If it's between 25 and 30, it means you are overweight. If it's under 25 means you are normal. So obesity does not really present itself with being fat. So that's a myth, and so let's not take that as someone who is fat as obese, unless then verified. Also, those who have poor diet, so those who don't eat well, they are likely to cause reduced amount of nutrition, that is nutrients, into the lymphatic system, and therefore this will cause lymphedema or swelling in the lymphatic system. So how does someone acquire this condition or have this condition called lymphedema? One, as we mentioned earlier on, when the lymph node is removed. Okay, and this could occur at any time actually. That is mostly after surgery. And also occurs mostly within 3 years of someone who has had a breast cancer treatment. So after you've had a breast cancer treatment, after 3 years, you are likely to have this condition called lymphedema, where your lymph nodes are affected, and there could be swelling in your hands actually, because and mostly it's affected at the arm where the breast was removed. And so if it's your left, mostly your left arm is affected, because the lymph nodes actually move from the breast region through the shoulder region down to the arm. And so mostly it's ipsilateral. So when we say ipsilateral, it's from the same side where the surgery was performed. Okay. And one thing to note is that the lymphedema actually occurs slowly. So early detection means good management and resolving. But when you notice the swelling and then you don't report as early as possible, this could spark or become worsened. And actually, when it becomes worsened, we have stages we'll be talking about very soon. We have stages of this condition: stage 1, stage 2, and stage 3. And if it's the worst stage, actually there's very little to do, and the surgeons also do their own job. Okay, so but early stages, we have physical therapy that helps to reduce the swelling also and improve the function of the hand. Okay, so there are so many research that have been conducted. Some say the early stages have a very good recovery time period. Some also say that the late stage has very unpredicted or unpredictable level of recovery period. But then it all boils down to early reporting to the hospital or to the hospital setting. Okay, so we mentioned the lymphatic system. So what does the lymphatic system do? Actually, it helps to transmit fluids, that is proteins and other nutrients, back into the system for circulation and back to the heart. And so the lymphatic system also assists in fat digestion. So when you've eaten a lot of fat, if you've eaten chicken, if you've eaten pizza, and so many fat substances, if you've taken in fufu and light soup and then gano soup, this structure we call the lymphatic system helps to break down the fat. We have also other structures we call the bowel. Yes, that helps to break down the fat. But also there's a supporting system or supporting structure system that helps to break down the fat, which is called the lymph or the lymph ducts. Okay, so we are talking about the use of the lymphatic system or the role of the lymphatic system. We have also that is transport protein, as we mentioned earlier on, proteins from the body, that's from the vessels into the tissues and back in circulation. Also, lymphatic system also removes excess water. So we know that about 70% of the body contains water. So this system where we find the lymph is removed excess water from the tissues. So the water that we drink, some of them go into the tissues to nourish them and to keep them very fresh. And that's why here that I can see I'm sweating a little on my feet. It's because we have some water around my tissues that helps to nourish my system and makes my system look fresh and better. So doctors and medical practitioners advise us to drink water as often as about 1 liter a day. And so this lymphatic system, where we find the lymph nodes, also remove excess water. So if you have too much you have too much water in your body system, the lymph helps to remove them, just as your bladder. So we have your bladder also that helps to remove the excess water similar to the lymph, but the lymph does not remove as much as water as a bladder. But then, as small as it is, we have so many lymphs in the body. So if you join all together, it could be equivalent to the amount of water the bladder excretes or removes from the system. And also absorb a lot of fat from the gut. When you say gut means esophagus. Esophagus is actually where the food passes. So when you take in food, there is a flap in between where the air enters and where the food passes. So immediately you take in food into your mouth like this, the flap closes and prevents the food from going into your lungs, else you suffocate and then you die. But then this flap closes and the food enters into your throat, down into your stomach. While you have your throat, we have something we call esophagus or gut. And so we have lymph nodes also around this side, around this side and right to your stomach. So these lymph nodes also absorb the fat. So some of the fats that we eat, the lymph nodes absorb them, and then when they are broken down to in your liver and in your bowel, this fat also absorbed by the lymph into lymphatic system, and so they help to control the amount of fluids that enter and leave your tissues. They also remove cellular debris or foreign materials in the body. So this actually is a very, very important structure. So if you have foreign body in your system, unknowingly this lymph also helps. It acts as a policeman, so it helps to remove this unknown substances from the tissues and sends them in circulation, and this also goes into the heart, and also there is reverse of the circulation, and this helps also to normalize the system. So the lymphatic system helps to remove cellular debris, that is foreign substances, out of the body. We have the bacteria, we have viruses, and we have cancer cells, and this helps to stabilize the body system and also to help the body function to at its normal peak. So we've mentioned lymphedema or swelling in the hands and the feet. So lymphedema, that is where we have too much of fluid in the lymphatic system, where we have lymph that are found there. When we have risk areas, so high risk areas, we have the arms and we have the chest and we have the back. So these are the three areas where we have high risk areas, because of the fact that more people who go through surgeries called the breast cancer treatment, their lymph nodes are affected, and so that is what research has said or statistics have proven so far. We are yet to have a more extensive study on it. Okay, so then we have the mechanism by which this condition occurs, that is the lymphedema. So we have structures in the body we call the vessels, then the tissues. So we have a structure we call arteries and veins, and smaller veins actually are found near the bigger veins, and you have smaller arteries also found near the bigger arteries. These arteries also transport enough oxygen. So when you breathe in air, the oxygen goes into the blood and then from the heart goes into the body. So when the oxygen in the blood goes into the body, it goes through the arteries into the body. And so these arteries also have smaller arteries, because some of the body parts we have are small, like our fingers, like our toes. Yes, they are so small that these big arteries cannot go there. So God has specially made it that we have smaller arteries so that they can penetrate or go through these smaller structures, that are our fingers and our toes. Okay, so these arteries also have an interactive or communicative component we call the lymph system, the lymphatic system, or the interstitial fluid system. So this blood goes to the smaller vessels called the arteriole. And these arteriole are very, very important, and they contain proteins, they contain other fluids that are transmitted from the artery system into the fluid system. And this fluid system actually helps to enable us have communication between the intracellular components, that is the tissue system, and then the circulatory components, such as the blood vessels. And so when there is undue communication, that is when there is too much of the fluids in the intracellular components, which some pictures will be shown to you very soon, there is high pressure in the interstitial components called the lymph system, and this causes lymphedema. And so we'll be showing some pictures of the arm very soon. Okay, so the main component that's affected is the lymph node, and so lymph node is very, very important for lymphedema to occur. We have the lymph, that's the breast lymph drainage, and so these are various therapeutical processes that we can do to be able to drain the fluids back into the system. Okay, so then we talk about the stages of this condition called lymphedema, or swelling in the hands or the arms, and then most likely the feet, one feet or the other. We have the stage 0, which is where we have the normal hands, where there's almost minimal to no swelling of the hand. And then have the stage 2, where we have the swelling becoming spontaneously reversible. So that is where we have sometimes the arm or the arms get swollen with you sleeping and waking up. You have the normal presentation of your hand, no swelling again. So when you sleep and wake up, the swelling in your hand goes down. But then when you rest a little, you perform activity, we have the swelling coming back again. So at this stage, it's actually present during the day, but then when you sleep and you wake up, the swelling goes down. We have something we call pitting. Pitting is actually a scientific process or confirmation, where if you have swelling in your palm like this, you have a lot of swelling around your hand. When you press your finger into, you can see some hole in the back of your palm, and that hole takes a longer time for it to vanish after you press. As you can see, some hole in your hand, so it's called pitting. And the amount of time the hole takes to get missing is referred to as the pitting time. So the longer it takes for the hole after you press, when you have a swelling, you could have a confirmation of stage 1 lymphedema. Or we have stage 2. The stage 1 actually is reversible, that is, it occurs and spontaneously reversible. Stage 2 actually also occurs spontaneously. It occurs at any tiny point in time, but then this stage is present actually after you wake up. So the first one is when you perform activity during the day, your hand gets swollen. Then when you sleep and you wake up, the swelling goes down. But the stage 2 actually is when you have the swelling in your hands or your arms or your legs after you wake up. So you slept and you wake up, when you sit down or you stand, then you have all of a sudden swelling in your legs or your hands. So this is a stage 2 type. And the stage 3 type, actually, it's very visible whether you sleep or whether you wake up. There is a very, very extensive swelling in your hands or your arms and then your feet. This condition this stage is actually irreversible, but stage 1 and stage 2 is manageable, and so you can control the swelling and then you can perform your activities as best as possible. That's why we said in the early stages or early presentation that early reporting actually gives you an early chance of normal life. Okay, so I'll be showing you some pictures very soon also of the breast cancer related treatment, and how the condition is faring. Okay, so just let me show you the pattern what I talked about. Okay, so this is the pattern. Okay, so you can see the pattern I was talking about. So this is the pattern. So you can see that the person can see the hole there. I'm sure you can see it now. The hole, that's the hole. Yes, so this is the hole. When you press a finger into this, you can see the hole here. It's called a pitting edema. Okay. Alright. So yes, so we're talking about lymphedema or swelling in the hands or the feet. So what are some of the changes that you can see when someone has lymphedema or swelling? We have too much proteins in the tissues. So the medical doctor will say go and do a test to see the amount of proteins in your interstitial fluid. That is where the fluids are just close or just beneath the skin. You have tissues around, and where there's too much fluid in your limbs, so you can see some swelling in your upper limb. Someone we can prognose, or we can say you might be having lymphedema. And also, if you have reduced amount of oxygen in your interstitial fluid, you could also have lymphedema. When there's also slow tissue healing time, so when you get hurt, when there's the wound takes a longer time to heal, it might not mean you have diabetes, but it could also mean you have lymphedema, because the amount of time for the tissues to receive the fluid needed, that is protein fluid needed for the healing process, is reduced, and so you could have lymphedema. And also, when there is formation of fibrosis, that is, fibrosis is actually a hard structure that is formed after healing takes place. So when there's deformation of this structure, we call fibrosis around the lymphatic system or the lymph node, we could have lymphedema. So what are some of the symptoms or some of the signs of lymphedema? So the person complains of tightness around the arm or the legs, or heaviness around the arms as compared to the other side. So if it's the left side of the hand, the arm, the patient or the person complains of heaviness in the limbs, then he or she complains of achy, the place it aches. So that is something that we call in our local parlance called is painful. The person complains of pins and needles, that is the place pricking the person, as if someone is using pins and needles to prick the person. And there is actually tenderness around the elbow, so the medical practitioner or the physiotherapist assesses the patient, and when we palpate or we touch with our thumb or one of our fingers to touch, specifically the thumb, to touch the elbow region, the person's elbow region looks tender. Okay. The person also feels discomfort, because this actually where we have too much fluid in the system, the person becomes uncomfortable because this hasn't happened to him or her before, and so there's some form of discomfort and then pain associated. Okay, so there are so many treatment, there are so many management systems for this condition, but then there's a network system which I'm sure my senior colleagues are also part, and we call the National Lymphoedema Network System, where we have so many management practices or management protocols to be able to see to the fact to it that there is good management and there is no outburst of this condition. So there has been this National Lymphoedema Network System where the therapists are trained. My senior colleagues have been trained. Yes, so acknowledging them for their hard work and then their dedication to management of this condition. And also there are risk reduction guidelines, which I'm sure when you go to the net you'll see them. And also treatments of this condition, then exercises to be able to manage this condition. Okay, so how do we reduce the risk of having this condition called lymphedema or swelling in the arms or the legs, or the hands and the legs? There is one thing we should note about skin care. So we should actually ensure that our skins are smooth. We eat also good food and fruits to ensure that our skin is very, 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 very good. It's not so rough, it's not so hard. There are so many fruits in town, and so we say an apple a day keeps the doctor away. Yes, so not only apples, but you have watermelon, we have pawpaw. Yes, these are all very important to help us to avoid lymphedema. We also have activity and lifestyle, so avoid engaging in too much activity, such as too much walking. Yes, walking also doesn't have any side effects, but then we also have our system, that's a lymphatic system, and this is very important to be able to ensure that there is no undue pressure in our lymph system. And also we should use something we call compression garments if we have swelling in around our arms and in our legs. And so this compression garment actually is given by the physiotherapist to be able to control the swelling and also avoid extreme temperature. So if the temperature is too hot, you also have to balance yourself. Either you relocate yourself to be able to manage this condition, to be able to manage yourself. And also if the condition is, or the temperature is too cold, you could also change or relocate. And so the skin care actually is that you keep your arm clean and dry, and then you always pomade yourself as often as possible, and then you keep your nails clean, and you cut your nails as often as possible, because when you have germs or infection in your nails, it could also draw you closer to having this condition called lymphedema, because your skin or this could be infected, and this could enter into your system. And that's why we advise that you cut your nails. Yes. Okay, so also we have to protect our skin with sunscreen and insect repellent. Okay, we also have to use take care when we are using razor blades to avoid cuts. So when there's cuts in the system, they could also cut your lymphatic system or your lymph nodes, and this will cause lymphedema. So when you're cutting your nails, you should make sure that you do it very, very well. Other than that, it could cut your lymph node, and this could result in lymphedema and could be disastrous, which, as of now, there is no definite cure for this, but there are risk management practices for you to live a better lifestyle. Also, when someone has this condition, if you know someone having this condition, it's advisable that you don't use your bare hand to touch the person's leg or the hand that are swollen, because this could be infectious. You could also wear gloves to be able to avoid infection transmission. Okay, so if you have this condition, you have to regularly wash your hands even as you touch that side, because this could be infectious also. If you have signs of itching, redness, pain, or increased temperature or swelling around the side, you need to, around your arms or legs, you need to contact your doctor as early as possible to be able to manage this condition, because it's an alarming condition which needs to be seen to as early as possible. So when you talk about your activity lifestyle, as we mentioned earlier on, you need to engage in exercises. That is, you could have walking every day, at least for about 10-15 minutes, and also repeat them as early as possible. If you have this condition, your arm exercises such as probably like this, in and out, in and out. This also helps to draw the fluid back into circulation, and it helps to improve the function of the lymph. Okay. And also, as physiotherapists, when we are treating this condition, we also have standard procedures. That is, we can measure the level of improvement or reduction in swelling of the lymph. So we have a chart we use. So we measure the hand region, the forearm region, that is the arm region. We measure this region, and we also measure this region, and the arm region, then the forearm region, the arm region. And then our subsequent visits, as we treat, we measure the level of improvement to be able to see how best or how better the condition is getting. Also, as we talked about earlier on, one of the risk factors being obese, that is having your level of obesity that is getting to more than 30, you could have lymphedema. And so we ensure that you check your weight and then also your height inclusive, and these, your weight over your height squared, could tell whether you are obese or not. And so very good diet and avoiding taking in fatty foods also often could help to control you and prevent you from getting lymphedema or swelling in your hands or your arms and then your legs. Okay, so they are very important. This is a very important point, and we should all take note that we should avoid wearing tight materials, especially to our legs and then to our hands. So we all know that people like wearing tight clothes in their arms and then their legs, but then this condition called lymphedema is likely to happen to such a person or such persons. As we mentioned earlier on, the lymph node are located at the superficial areas in our body, and so when we wear tight clothes, when we wear tight trousers, we are likely to constrict them, we are likely to compress them. And so when they compress them, it means there is less or no communication between the tissue component and then the vessel component of the body. So there could be too much proteins in the tissue component, which will cause the body to swell up and cause lymphedema. So avoid wearing very tight clothes, or that is to your arms and to your feet, even to your chest region. You would reduce the risk of having this condition. And also, if possible, never have your blood pressure taken on the arm at risk. So if you have, or you notice that your hand gets swollen intermittently, that is as and when, if you're checking your blood pressure, tell the person who is checking you not to check on that side, because there could be a minor injury around the side to the lymph, but then constantly applying much pressure could cause a worsening of the current state. And so avoid checking blood pressure around the side. Also, we have something we called, I mentioned earlier on, compression garments. So when patients wear it, actually this garment actually control pressure because they are elastic. So when you wear it, it helps to push the fluid back into the system, back into the heart, and then it helps to return the limb to its normal function. And so we prescribe it as physiotherapists to patients to be able to manage this condition. So some of the caution that we have to take note as someone having lymphedema, or someone having some of the signs of lymphedema, you have to avoid extreme cold temperatures, as we mentioned earlier on, and then avoid extreme heat conditions for more than 15 minutes. So where you are, if the place is very hot, at least for about 15 minutes, you can change your location and come back again if possible. Okay, so what one can do if you have this condition called lymphedema, you need to see a very certified lymphedema therapist. So as we mentioned on, we have specialists in this condition. My senior colleagues are very much specialized in this condition, I would not like to disclose their names on this international platform. But then, when you come to any hospital, any teaching hospital, you can come to Kolebu, where they are found, we could have this condition being treated as best as possible. So early treatment, as we've been saying from the beginning of this presentation, is very, very important. As early as possible, when you notice that your hand or your legs are getting swollen, as early as possible, you need to come and see the physiotherapist or the medical doctor, who will most likely refer you back to the physiotherapist. Okay. So there has been so many trainings gone throughout the world, and Ghana is not an exception. And so we have specialists who are trained to manage this condition. Okay. So we have also stages of treatment for this condition. We have the skin care, we have fluid drainage, we have something called lymphatic fluid drainage. That is when we have various types of massage to push the fluid back into the system. And these are very, very important protocols that we go through as physiotherapists or specialized lymphatic therapists to be able to get the hand or the leg function return back to normal. We also have exercises that we go through, aerobic exercises or gentle progressive exercises, and then finally the use of the garment. So these are very important protocols that we do with patients who have this condition called lymphedema. So some of the lifestyle modifications we have to do, or cautions when someone has or this condition, is that we have to wash our hands as often as possible immediately we have contact with the hand or the affected leg or the affected hand. And also we shouldn't cut too much of the cuticles. Cuticles are actually found around the nail region, so we shouldn't cut them we shouldn't cut them to the max. Okay. Also, we also have to prevent infection. So if we have areas where we know that these places are infectious areas, such as the hospitals, we should take care so that we don't get the region infected, and also avoid getting wounds or getting hurt around the structures or around the structure that has been affected. If it's the arm, avoid getting wounds. Also, keep the skin working optimally. That is, you moisturize the skin to allow the fluid to drain. Also, elevate your arms to allow the fluid. So when you're going to sleep, we have 2 pillows or 3 pillows or a pillow to elevate the arm. So if the arm is swollen, you have to elevate the arm so that you can allow the fluid drain back in the system. Okay. So we have so many exercises we can do, massages we can do. So let's look at. So you can see one, as this is a therapist doing some massage for the patient. You can see someone who has undergone breast cancer, and then there's a massage to drain the fluid back into the system. Okay. So we'll be showing you some pictures. These are just intermittent pictures to show to you. And so we have massage we do. Then this helps to reduce the amount of fluid around the affected area, and also to reduce pain, and also to encourage or improve circulation. So this garment that I've talked about actually helps to stretch the skin and also to drain back the fluid into the system. So I'll be showing you some pictures very soon. So let's look at the garment. So this is called the pressure garment. So this is what I was talking about initially. Okay, sorry. So this is the pressure garment. We call the pressure garment. So the patient has swelling in the upper arm, the right upper arm. So the hand, so you can see the whole upper limb is swollen. And so this is the pressure garment. We call the pressure garment. The patient wears it to allow the fluid to drain back into the system. Okay. So we are talking about lymphedema. So swelling in the arms and then the legs. Okay. So I'm sure you are getting used to the topic. We understand the topic as we are discussing. So there are so many exercises that we do as physiotherapists to encourage or to improve circulation as and when someone has swelling in their arms and their legs. The first one is actually we have aerobic exercises, endurance exercises such as walking if the limbs are swollen or the lower limbs or the legs are swollen, and also aerobic exercises. Okay, so I want to state this fact that aerobic exercises actually will impair circulation. When we talk about aerobic exercises such as the early morning aerobic exercises such as going up and down with music, up and down, up and down. So this actually is very not prescribed for someone having lymphedema, but we have gentle exercises such as stretching. So you bend your, if this is my foot, I bend my foot backwards and stretch a little and raise it up and down, up and down. These are exercises that will gradually strengthen the structures supporting the lymph or around the lymph, such as the muscles, the tendons, and other structures. And so this will help to improve circulation, but too much of exercises could put undue pressure in the lymphatic system, which will eventually collapse the system. So aerobic exercises actually not good for someone having lymphedema. We have stretching exercises. We also have swimming, so which I'm sure in this part of our world we have less of. We have very little swimming abilities. We have diving, we have singing, we have yoga, and we have other exercises or other protocols that we do. And also we encourage deep breathing exercises. Actually, it's shown by study that breathing exercises, that's the diaphragmatic breathing exercises, such as you breathe in, and hold, and then breathe out. So you hold like this, and you breathe in, then out. So these are exercises that we do as physiotherapists to also bring the fluid back into the system, back to the heart. Okay, so I've mentioned some of the exercises that we do. We have stretching exercises that we do as physiotherapists. We teach the patient. We also have strength training exercises. So minimal strength training exercises to improve the function of the particular arm or hand or leg involved. Okay. So there's been so many research that have been carried out. We have the network in lymphatic network in Pennsylvania, far away in the US, who have conducted studies with people, about 154 survivors without edema and 141 survivors without edema, and the results have shown that they had very good improvements. That is, the condition was worsening very minimally. So about 7% had the condition reduced. That's the likelihood of them having the lymphedema was very reduced, and so about 50% of them had quite an incidence of it recurring again. And then generally after treatment there was improved strength, and then there was improved energy around the affected organs, the affected structures, and also there was reduced body fat as a result of therapy, because I mentioned earlier on that some of them are obese. So with exercises and with nutrition, with good nutrition, the weight loss goes down, and this also helps to manage this condition called the lymphedema. Okay, so let's look at some pictures as we wrap up our discussion. Okay, so without much ado, let's look at the pictures. I'm sure that we'll come to the end of our discussion. Okay, so this is virtually the bandage I was talking about. So we have the, just a minute. Okay, so you see the bandage here. So bandage the palm region, we don't bandage the fingers because the fingers need to receive enough circulation. The fingers have small arteries, which when you tighten them too much, they could cause a condition we call venous disease, and so we want to avoid this. So we bandage the whole hand. So depending on the arm, if this is the right hand, the right upper limb, so this is it. So we bandage the whole arm here, and this is very important to allow the fluid to drain. So the bandaging is actually, we call it dictoproximal. So you tighten it from the hand side and then loosen it as you go up. So it means if you are tightening it here, it means there will be enough pressure to push the fluid up as you loosen the ones on top. Okay, so this is actually a mechanism that we do to manage this condition. So these are some of the statistics or the epidemiology for this condition. Do we have more people develop this condition? Males have this condition more than females because it's shown that males are more active than the females, and also it affects mainly the legs more than the hands. So if someone is for this, sorry, yep. So this is where we reached so far. So we have more males being affected than the females, and we have the condition affecting the legs more than the hands because there's undue pressure in terms of walking as compared to the hands, which are not so much under pressure. And so aside the fact that the males are more affected, males or females who are adolescents, by research has been shown that females who are adolescents tend to be affected more than the males, which is an exception to the general conclusion. Okay, so this is a way of assessing the leg. Okay, so these are some of the risk factors of this condition. We have infection, trauma, obesity, inflammation, a disease around the structure, surgery, or even doing. Okay, so this is a physical therapist who is specialized in lymphedema, trying to massage and trying to exercise the patient's leg which has been affected. So this is the lymph system. I mentioned earlier on, this is your leg, this is the lymphatic system. You can see it here. Yes, so this helps to push the fluid back into the system. This is the lymphatic system. So where we have the swelling around this side, there is undue pressure in the tissues and causes too much fluid to be accumulated in and causes the swelling in your leg. So when you see your legs here, the fluids are too much and becoming swollen. Yes, you can see it here. And so this is what I was talking about, the pitting. So you can see the hole there, very big hole. And so these are signs to show that the person has lymphedema. So you can see the legs are very much swollen. Both legs are very much swollen. Yes, so the person could have lymphedema. So there's most places that are affected are the hand, the arm, and then the legs. Okay, so this is actually exercise for someone having lymphedema. So the person has a compression device. So the person is wearing a compression device. This helps to improve circulation and also to reduce the swelling in the legs. Okay, so you can see this is very visible here. So this is the early stage. This is a minimal swelling. This is actually the moderate stage. Swelling. This is very severe stage where the whole leg is swollen. Okay, so this is what I was talking about, the lymph system. So this is the vessel, this is the veins here, this is the artery here. So this is a smaller artery we call the arterioles, and this is also the smaller veins we call the venos, and this is the interstitial system. So this is it here. So the veins and then the venos are the small veins, and arterioles, the smaller arteries. So they transport the proteins and the substances into the system. So it goes here and goes into the capillary, that's the lymph capillary. The proteins go inside and they send them into the tissue system. These are the tissue system. You can see them, the yellowish diagram. So these are the lymphatic system. And then when they finish and they use them up, they send them back into the venous here. Yes, you can see them here. They send them back into the venous. Oh, sorry. So they send back to the venous. So they can see the so they go back into the venous system and go back to the veins and go back straight to the heart. Okay, so this is an extensive presentation of this condition, this structure. Okay. So these are the lymph nodes. So you can see them here. The green ones are found almost in the system. So all the green structures are lymph vessels. Okay. So we've seen the swelling in the system, and I'm sure that we can appreciate this condition the better. So without much ado, we've talked about the condition and how they look like and the risk factors who are affected. We've talked about some lifestyle modification, what to do, let's control our diet, check whether we are obese or not obese, some factors such as engaging ourselves in not too much aerobic exercises when we are likely to have this condition, or when we see some swellings around our body such as our hands and legs. And also we also take care of our diet, what we eat. We shouldn't eat too much fats. And aside that, if we are having this condition, we should report as early as possible, and also avoid putting our hands and our legs down for a longer time. That is, if we experience swelling often in our hands or arms and our legs. Okay, we've seen exercises that we can do, we've seen the garment that we can wear to be able to ensure that we have the fluid drained back, and then avoid the worst of the situation where we are likely to have a surgery. So we want to avoid surgery, and then rather do exercises to be able to push the fluid back. Okay, so yes, I'm sure we've learned a lot. There's more to learn about, and so if you want to get to know about this condition, you can just contact me, and I'm sure we'll have an extensive discussion about this condition. So thank you very much. This is the end of our presentation for this evening called Lymphoedema. I'm sure you enjoyed our discussion, and if you have any question, you can ask it. So there's so many people joining in and out. I can see fear. I saw quite a number of people joining in and out. Today is 24th of May, and I'm sure you were supposed to have the discussion yesterday, but due to the power fluctuations, we weren't able to have it, and we had it today. But we are sure that by this Sunday we'll have the next topic for discussion. Thank you very much. So our next topic for discussion is called sarcoidosis. It's a strange topic, but I'm not going to give you the explanation, but I'm sure the flyers will give you a fair idea of what we discuss on Sunday. Have a blessed evening. May the good Lord be with us all. Take care and bye.